everyone. I, Dr. Ritika Dhiman, welcomes you all to these virtual discussions, Osteo Talks, organized by Voice of Healthcare in association with Dr. Reddy's Laboratories. Via these discussions, our leading experts shall share their insights on the common early signs, symptoms to look for in females, along with management of osteoporosis in general. So, before starting with this discussion, I would like to introduce our panelist for this session. So, I welcome Dr. Anindya Basu, who is a neuro and spine surgeon at the Institute of Neurosciences, Kolkata. Welcome, Dr. Basu.
Thank you.
So, now starting with this, I would ask a few general questions regarding, osteoporosis awareness. So, Dr. Basu, what are the risk factors associated with osteoporosis?
Right, Dr. Ritika. Basically, what we see is generally age. Age, like in aged people, we see osteoporosis very commonly, especially aged females. And men also get osteoporosis. We'll come to that later. In later part of the show, we'll discuss that. But yeah, I mean, there are certain risk factors like prolonged use of steroids for certain conditions. It can be due to less exposure to sunlight because some people they are inside away from sunlight for a long time. They spend most of their day indoors, or it can be due to less physical activity, less exercise, less weight bearing exercise. All these factors, certain chronic debilitating diseases which make people bedbound or make them less mobile can also give rise to osteoporosis. So there are various factors of which age, female sex, and less mobility and lack of good diet also can contribute to osteoporosis.
Right. So diet and age and the sex of the patient, females, it's more prone. So as we say, with age, fractures are also more common in females, right? So what do you think? Which bone fractures are the most common? Warning fractures that we commonly see in osteoporotic patients.
Right. So in osteoporotic patients, we see spine fractures very commonly. The typical scenario is an elderly lady who just started having back pain, and the pain has increased over the last, few days or weeks. And in this kind of scenario, when we get an X-ray or sometimes we get an MRI scan, we pick up a vertebral fracture. So the spine fracture is most common in osteoporosis, and it starts with back pain. Sometimes it can be acute back pain. Sometimes it can be chronic back pain due to small fractures in different vertebral bones along the spine. That can also give rise to chronic back pain. So vertebral fracture is something which we see very commonly.
So apart from, as you said, vertebral fractures and spine fractures are more common. So is there any specific symptom that is associated with the spinal osteoporosis, or, the patient can look for if they have, a major amount of spinal osteoporosis, or we can, segregate into a spinal osteoporosis?
So I think back pain is a warning sign. I would say, sometimes we do relate back pain to lumbar spondylosis. Of course, lumbar spondylosis is very common, but in elderly females or in patients or in people who are more prone to osteoporosis, for example, like just I mentioned, in patients who have had steroids for a long time, who are a lot less exposed to sunlight, who have been bedbound for a long time. In those patients, if you suddenly they start experiencing back pain and the pain is getting worse with time, you should be suspecting an osteoporotic fracture, or you should be suspecting osteoporosis setting in the spine of these people.
So, as you know, back pain is something very common in females, and they don't even think about it as a osteoporotic symptom. So what is your take on this? How often do we can check for these spinal osteoporosis signs and symptoms? Because a back pain is a very nominal thing, which a female of that age, thinks that is an aging factor, not as a osteoporotic, sign or a symptom.
Right. I mean, like all females more than the age of 60 or 65 should undergo a regular checkup for osteoporosis. So maybe an annual. We don't have a set program for osteoporosis prevention and screening in our country, but it should be made a norm that females above the age of 60 should undergo a bone density scan, which is called a DEXA scan, at a certain interval, maybe 1.5 to 2 years, or maybe longer than that. Or especially women who are more prone to develop osteoporosis, who are at risk of developing osteoporosis, especially women who have had their menopause early. So in those or have had conditions like had to undergo a hysterectomy or a oophorectomy at a young age, those women, they do have to undergo regular checkup for osteoporosis to see whether they are developing osteoporosis.
So, what do you think? How do you think the menopause is associated with osteoporosis? What is the connecting link that is, menopause has with osteoporosis?
So basically, it's like a hormonal imbalance that occurs in the, women at the time of menopause. It's a lack of estrogen. Estrogen is generally a protective hormone for the bones, and when the estrogen level falls in the body, or there is an imbalance between the estrogen levels and the other hormonal levels in the body, at that point of time, the bone loses that, protector. So the bone turnover is more, and women are more likely to develop osteoporosis due to lack of estrogen.
Right. What do you think are the differences in the prevention of osteoporosis in India and other countries like the US or UK?
I think it's a lack of awareness. So till now, I don't see. I mean, maybe in the last couple of years, there is more awareness of osteoporosis, about osteoporosis, that I see around in my country. But I've worked in the West as well. So there, I think there is more awareness in the elderly population about this entity called osteoporosis, and they want to get checked whether they have osteoporosis. Some countries do have a osteoporosis screening program for the elderly, and also for the ones who are at risk of osteoporosis. So I think, yeah, so it's awareness among the population. It's a awareness. It's their they should feel that it's their responsibility to get checked whether they have osteoporosis or not, and not identify osteoporosis when they have had a fracture. So I think that is something which we need to look at. We need to look at and we have to keep in mind that our country is having a aged population which is steadily growing with time. So we do our life expectancy is increasing in India due to good preventive healthcare, due to good health infrastructure across the country, and also so that's how we are having a good sizable population who are above 60, who are above 50, and they are active and they want to lead an active life. They want to work till their 70s or mid 70s or 80s. So we do have a population who want to be active even when they're elderly. So with this background, it is very important to maintain their functional ability. They should be able to keep in mind the fact that they need to check for osteoporosis, and they don't slow down due to a fracture that they may have due to lack of diagnosis of osteoporosis.
Yes, rightly said, Dr. Basu. What do you believe that India can do differently in terms of awareness in regards to osteoporosis?
I think, yeah, there's a lot to do. I mean, we have everything to achieve in terms of awareness of osteoporosis. Like for example, in October 20th October, I believe is the World Osteoporosis Day. I mean, we should create a lot of. We should try and create a lot of buzz about osteoporosis during that time. We may kind of declare October as an osteoporosis awareness month, and try and bring out media campaigns, social media campaigns, and try and use, try and take the help of celebrities who have been, spreading awareness about different diseases that are like tuberculosis, like malaria, like dengue. These kind of the people, because people are more people are more receptive, or they tend to understand more if the word comes from somebody they know, somebody like a cricketer or a film star that they adore. If a message comes out in the media or in the social media, so that elderly people or people at risk of osteoporosis should check at a regular interval for this disease, I think that is going to help. And also, we should have some intervention from the medical regulatory bodies or the health ministry in terms of a national osteoporosis prevention program or a prevention and treatment program like we have for tuberculosis. I understand tuberculosis is a menace compared to osteoporosis, but at the same time, if you look at the burden of the fractures, that is there in the country due to osteoporosis, that is huge. We don't talk about it that much. We treat the fracture but not the cause. I think it's time that we try to identify the cause of these fractures and try to prevent them rather than treat the fractures with different fancy rods and screws.
Yes, I think patients feel that, fracture, they have fallen and the fracture has occurred. They don't want to know about the reason behind it. Could be osteoporosis. They don't treat osteoporosis as a disease itself. They just know that,
Okay.
I have been fallen, and that's why the fracture have occurred. But they don't, tend to know the intensity of why their mineral bone density is low, or why the fracture has happened. They just seem it as a sign of aging. So, for example, for spinal osteoporosis, back pain, they just see back pain as a sign of aging. They don't see it as, it could be a disease, or osteoporosis is a disease. So I think that is the kind of awareness that is missing in people. So, do you think there should be a set of specific protocols, that needs to be set in regard to the preventive screening or the awareness that should be done for osteoporosis?
Yeah, I mean, as I said, that we need to have a screening program, a detection program for osteoporosis for the elderly population and the ones who are at risk of osteoporosis. Like, many countries do have a screening program after 65 in women, and also for the women below 65, they do have and the ones who are at risk, they do have a screening program. So we should, and the ideal test for a screening test for detection of osteoporosis is a DEXA scan. And this is another challenge that we have in our country is compared to the population of our country, the number of DEXA scan machines is terribly low at this point of time. Even in major cities like Kolkata or Delhi or Mumbai, I'm sure that compared to the population that required this test, the number of machines are terribly low. So this is something which the government has to think about. The private healthcare cooperators they should also be thinking about increase the number of DEXA scan machines across the government as well as the private sectors, and try and detect as many cases of osteoporosis as they can to help people to identify this disease.
Right. So Dr. Basu, we have an interesting question, in our comment section, that, how patient will come to know about osteoporosis in spine. What are the symptoms that are different from, general osteoporosis?
Let me tell you, osteoporosis itself is a silent disease. It doesn't let you know that it's making your bones weak unless you have a fracture. So you don't understand that you have osteoporosis. You only understand that you have osteoporosis when you have a fracture. And spinal osteoporosis, uh, similarly, will let you know that this you're having spinal osteoporosis when you're having a back pain, and the cause of the back pain is microfractures in the spine. If it's very acute back pain, you may have a kind of a significant fracture. If it's chronic back pain, which is gradually increasing over time, settling down at times, but again increasing, with the slightest of activities, then you're developing small fractures in your back. So if you have a chronic back pain which waxes and wanes with time but never heals, you get yourself tested for osteoporosis.
Right. So are there any different in the treatment modalities of, osteoporosis in general, and, it is different from spinal osteoporosis? Are there any difference in the treatment modalities?
Look, the basic remains the same. You need to have, first is, you start from zero. I mean, like zero is get a nutritious diet, get a diet which is rich in vitamin D, rich in calcium. Take your vitamin D and calcium supplementations. Make sure that you're having at least 700 milligram of calcium every day and about 10 microgram or of vitamin D every day through your diet. You know, if required, talk to a dietitian, get your diet right, so that your diet is full of, is rich in vitamin D and calcium resources. That is your step zero. And then you should look towards having a balanced activity. You should be looking to uh, do at least 2.5 to 3 hours of aerobic exercises, including walking, cycling, running, whatever you can afford to do or your body permits you to do. You should be able to do. You should be doing that to keep your bones healthy. And weight bearing exercises, muscle building exercises, all these kind of things contribute to your bone health. So you should be looking at treatment of osteoporosis as a whole, not as just giving some injections or taking some calcium pills. It should include start from having a good diet, a balanced diet, taking supplementations, and then of course for spinal osteoporosis there are certain drugs which are more helpful than the others, like bisphosphonates are helpful. Teriparatide is a drug which is really helpful. Denosumab helps in treating osteoporosis in spine. So there are drugs which are particularly helpful in post-osteoporotic women. The selective estrogen receptor modulators can help in building up bone mass. But it's very important to have good diet, balanced lifestyle, so that you do regular exercises, you're exposed to sunlight on a regular basis. So all this is important.
Yes, rightly said that prevention is always better than cure. So we have one more, interesting questions from in our comment section. That is there a connection of our lifestyle and constant desk posture to the occurrence of spinal osteoporosis?
Lifestyle is absolutely yes, right? Like I said, sedentary lifestyle, lack of exposure of sunlight, no exercise, all this kind of these things are putting you at risk to to having osteoporosis. So as I said, you should have a some kind of an aerobic exercise for at least 2.5 to 3 hours a day, 3 hours a week. Then you should be having a balanced diet. You should be taking vitamin D, calcium supplementations after a certain age, especially if you're a lady. And of course, poor posture can lead to spinal problems like spondylosis and degenerative spine disease, but it doesn't per se increases the risk of osteoporosis, but can give you back pain if you're sitting in a wrong posture for a long time.
Yeah, so in COVID, so people were working from home and they don't have any specific posture, or they were just sitting and doing work from home. So is there any criteria, to how not just how much time do we spend on chair in an office setting or a home setting when we are working from home, or from office? So is there a particular criteria for the time that we spend sitting on a chair, or
Like
we can follow?
what I tell my patients is that you when you're spending a lot of time on a chair, like I do myself, you can see I'm sitting in my clinic right now. So I do spend a lot of time. I've been seeing patients in since 11:30 today, and it's almost 5:30 now. So I've been sitting in a chair for a long time, And similarly, with people working in office or they're working from home, they have to sit in a chair for a long time. And in this scenario, it's very important that you have a comfortable chair. You should have a neck rest or a headrest, something like this. You can see in my back. They should have a lumbar support to support the lumbar curvatures of your spine. Basically, you have lordosis. You have a curvature in your neck as well as your back, lower part of the back. So your chair should be supporting these two curvatures well, so that you can, when you relax on your chair, your spine is well supported. So that is important, because if you're not able to, if your spine is not supported uh, while you're going back on your chair, that is something where your muscles are not at ease. So that's something. And also, what I tell is every 20-25 minutes you get up, just stretch yourself, do some stretching exercise of your neck, back, lower back, stretch your arms, okay, stretch your legs. So this kind of stretching, keeps your like helps prevent a lot of back and neck pain, when you're working for a long time sitting in a chair.
Yeah, because people don't take breaks while working in the office or out of the office. So I think after 20 to 25 minutes, you should take a break or stretch your, as you
Absolutely.
have rightly said. Yes,
You're not able
it
to
can be
concentrate if you're working for
beneficial.
a long time. You're not every 20-25 minutes your concentration span breaks. So you're able to give more productivity to your organization if you're taking a 2 minutes or 3 minute short break, as you call power breaks. Every so that you come back fresh and just work again well for the next 20-25 minutes. I
Yes,
mean,
yes,
sometimes we can't afford to do that while we are operating, doing a surgery. But yeah, if
yes.
possible, we could have done that.
Yes, we can have also have a ergonomic chair or right. So yes. So we were talking about spinal osteoporosis. So what do you think are the treatment options available in case of severe spinal osteoporosis in India, and how they are different from what we have in the Western countries like US or UK?
To be very honest, there is no difference in treatment options between India and the Western world. There is no difference. The molecules that are available here that are approved for treating osteoporosis in the West are available in this country. For example, denosumab, teriparatide, bisphosphonates. These are the cornerstone apart from treating osteoporosis. Apart from uh, calcium and vitamin D, these molecules are used in every country, and they are the mainstay of treatment of osteoporosis, severe osteoporosis. I think they are well available here in India, in Kolkata, in any major city, or even the tier B cities. So, as far as the drug availability is concerned, I don't think that's a problem. As far as treatment of osteoporotic fractures is concerned, I don't think that's a problem as well, because the osteoporotic fractures, we tend to do some procedures like vertebroplasty or a kyphoplasty, which is putting in a bone cement in a fractured bone so that the bone becomes strong and the pain decreases and the patients are able to mobilize from the next morning. And also, so these procedures are widely available in any major city, in any major hospital, or even in government hospitals, private hospitals, everywhere. There are trained surgeons doing these procedures day in and day out in every city of this country. And also, if required, we can do a spinal fixation, which we can do in an open surgery, as an open surgery, or we can do it as a minimal invasive surgery. So those surgeries are also done by spinal surgeons, be it neuro or orthopedic surgeons in every city of this country. So as far as treatment options for osteoporotic fractures is concerned, I don't think there's a huge difference in between Indian cities and the cities of the West. Of course, as far as treatment options are concerned in the rural part of the country, I think there may be a little bit of gaps at the moment, but I'm sure we'll be able to bridge that gap in the near future.
Yes, I think the difference is in the awareness of the people in India and in the Western countries. The treatments part is as you said is the same. It's the kind of preventive protocols or screenings that the country have or have set the protocols there too. So, so coming to the end, we generally talk about the females being more prone to osteoporosis, as prevalence is majorly seen in females. But what do you think are the symptoms seen in men in regards to osteoporosis? How prevalent it is in men's?
Yes, it is prevalent in men. I mean, you can't say that men do not develop osteoporosis. So, up to 1 in 4 men over the age of 50 may break a bone due to osteoporosis. That's quite an alarming figure. But it is less prevalent than in women, osteoporosis in men, because they do tend to produce a hormone called testosterone for a long time for a long period of time during their lifetime. So testosterone is something which protects the bones, so it prevents osteoporosis from happening. Uh, for example, a standard lady at 60 is more prone to develop osteoporosis than a gentleman at the age of 60. But males who are having low testosterone levels or who are at risk of having osteoporosis, like they have been, if they are on steroids for a long time, or if they have been smoking or drinking too much. I'm not being gender biased because there's no relation between smoking and addiction to alcohol between sexes. But yeah, if these are the factors, if these are the factors, then they too tend to develop osteoporosis as well. And of course, osteoporosis is a silent disease. We don't understand that we have osteoporosis unless we break a bone. So they do have back pain, and if you investigate with an DEXA scan, you'll find that that even men have osteoporosis quite frequently.
Right. So thank you so much, Dr. Basu, for having this wonderful session with us. So coming towards the end of this session, I would like you to share your thoughts or a one-liner message to our audience.
Prevent osteoporosis, have a healthy lifestyle, do have calcium and vitamin D supplementation, and enjoy the sunlight, and do exercise regularly.
Yes, thank you so much, Dr. Basu, for your time. And, we'll always look forward to having you.
Thank you. It's been a pleasure being in this show, and thanks for interacting with me.
Yeah, it was a great interactive session with you.